The number of new infections in India's Omicron-driven third wave appears to be dropping. Cases have not been as severe as the deadly second wave, but it has still taken a toll, especially in large cities. One of the critical components in the country's healthcare system are community women workers. They go door to door to check on people and help them. But these women at the front lines feel they never got the recognition they deserved. And in New Delhi, thousands have gone on strike this month. Here's DW's report.
These women are angry. For 11 days now, they have been blocking an arterial road in the heart of New Delhi. They are primary health or Anganwadi workers, as they are known. During the last 2 years, they have been at the front line of the pandemic at the grassroots level. They distributed masks, promoted vaccinations, and raised awareness. They worked through lockdowns and coronavirus waves without any protective equipment for themselves and earned as little as 60 euros a month.
We weren't even given sanitizers. We arranged for masks, gloves and sanitizers on our own so that we could continue our work.
I've worked for 36 years in this job, but I'm not entitled to a pension. This is why we are protesting for basic worker rights.
We get no protection. I've lost 3 family members to coronavirus, yet I went to work with my toddler in tow because we were told we cannot take leaves.
Thousands of workers here are demanding better working conditions and more pay. Poonam Rani has run an Anganwadi center for 9 years. She says she is so overworked that she doesn't have time for her own children.
The government doesn't value women's labor. They think we will work a lot for very little wages. As women, we end up accepting these terms because we figure at least we're earning something, because unemployment has skyrocketed under this government.
Anganwadis were first set up decades ago to fight child hunger and malnutrition. Women like Rani helped monitor the health of children and their mothers and distribute food rations. With this immediate link to families, Anganwadi workers like Rani have close access to the 1,000 people they each have under their care. So over the years, they've been charged with looking after many additional social benefits and are now handling extra duties to help out during the pandemic without any added compensation.
Despite their increasing workload, these workers are only recognized as volunteers. One of the key demands of these protests is for them to be given the designation of permanent employees of the government and to also receive the benefits that come with that job.
This would include health insurance, pensions and vacation, costs which union leaders here say the government is reluctant to take on. They say the current system blatantly exploits women's labor.
They are not producing a tangible commodity, but they are in a service which is crucial, which is essential, and without which even governments can't function. I believe that government is trying to run away from its principal responsibility.
The Delhi government is yet to respond to these protests. These women are now planning to travel through the country to call out what they say are the false promises political parties are making to workers.
That report from DW's Namisha Jaiswal and Ahmad Sharik. Let's bring in DW's Delhi Bureau Chief Amrita Cheema. Thanks for joining us. So, no response yet from the government. Is there public support for these community healthcare workers, or are they on their own?
No, there is considerable public support for these workers. You know, they play such a key role at the grassroots level. They have a deep reach in the community, and which is what makes them such a valuable resource for the government in times like this, in times of a pandemic. They have connections, they have deep relationships in the community. Now, the heart of the problem really, Melissa, is that these workers are viewed as volunteers and not as employees. Now, this is where the unions are fighting the battle for these workers and say these people should be treated as employees and given all the protections. There are talks now going on between the government and the unions, trying to look for some kind of a compromise and see what they can come up with. But the last time these women got a hike was in 2017, and that was after 50 days of strike. So these women are very determined, and they're going to be sitting there quite literally till they get what they want.
Got it. Now, Omicron infections are easing in some parts of the country. Is there a sense that India's healthcare system is on top of the situation?
Now, the healthcare system is in a much better position than it was last year during the deadly Delta wave. And there are two reasons for this, Melissa. One is that the hospitals and authorities were much better prepared than the last time. And secondly, the Omicron wave is very transmissible, but it didn't spread as fast as people thought it would. And also, it's simply not as deadly as the Delta wave. The last year, when the Delta wave took India by storm, we saw horrific scenes, if you remember, people gasping for breath and actually, not having enough oxygen. So many people died, not enough hospital beds. But this time, things are much better. And as I said, a combination for the fact that people are better prepared, hospitals are better prepared, and they're facing a variant which is not as ferocious as the last time.
India faced the huge task of vaccinating, more than 1 billion people against COVID. I'm curious how that's coming along.
Actually, Melissa, pretty well. After a fairly slow start, vaccination has really picked up, and the health minister gave latest data on the number of people vaccinated above the age of 18, those who are eligible. He said that 95% had received the first dose and 76% had received the second dose as well. And he also talked about teenagers, people between the ages of 15 and 18, and said 10 million of them had got both doses. So India is doing pretty well in terms of vaccination. As you said, over 1 billion people to be vaccinated. And to get that number as high as that is quite a significant achievement.
That 95% is better than Germany. And now we've seen mass gatherings like religious festivals and political rallies drive new surges in the country. And I know we have a big regional election getting underway in Uttar Pradesh. It's a state with 200 million people. I'm curious, have there been steps taken to control crowd sizes there?
In fact, Uttar Pradesh has a population which is half the size of the European Union. So elections which started there today are going to go on for a month in 7 phases. The Election Commission gave guidelines as to how these rallies and campaigns could take place. But, of course, no one is paying any attention. The Election Commission said not more than 50% capacity in indoor auditoriums and not more than 30% outdoors. They said only 20%. Only 20 people were allowed to go for door-to-door campaigns. They put a bar on rallies, processions, and so on. But if you look at the pictures, you will see that no one's paying any attention to these guidelines. Many thousands and thousands of people are out at these rallies. There's no social distancing. Hardly anyone is wearing a mask, not even the politicians. So we'll just have to wait and see, Melissa, what happens after these elections are over in a month or so. Because last time, in a similar situation when there were regional elections in India, we saw a huge spike in the number of new infections.
DW's Delhi Bureau Chief Amrita Cheema, thank you for that roundup. Turning now to the challenge of long COVID, which some now call the parallel pandemic. Estimates suggest more than 1/3 of COVID survivors will develop symptoms that linger long past the initial infection. They can range from headaches to fatigue and also to more serious conditions. We take a closer look at this from India, where DW's Munir Chaudhry reports.
Sadhna Tandon calls her pet dog Pepper her lifeline. She says the pup keeps her on her toes all day, something which she says was not possible just a couple of months ago. 63-year-old Sadhna was infected with the coronavirus during the second wave. While her initial infection was not severe, a few days after testing negative, she was diagnosed with cardiac inflammation, a post-COVID complication which left her with a crippling weakness for months.
I used to feel so weak that I would at times used to feel I can't even sit. I must lie down. I hardly had any stamina. I was, though, a very active person earlier. And I started feeling depressed also. I used to feel very low.
Sadhna's case is not exceptional. Many other people have suffered from post-COVID complaints, more commonly known as long COVID, a name given to the persistent illness a person feels while facing symptoms or effects for weeks or months after testing negative for the coronavirus. Dr. Ayush Gupta says patients have come to him with complications like headache, fatigue, depression, palpitations, and cardiac issues, among others.
A staggering number, that is 60 to 70% of patients who recover from COVID have these effects on them. There are some kind of risk factors which predict long COVID. Duration of illness is one, severity of illness is second. It is not completely understood. It is a science in evolution. So even young patients may be experiencing more symptoms than an elderly high-risk patient.
30-year-old Roshni Divakar was an avid yoga practitioner. She says she was at her healthiest stage when she tested positive during the second wave, and her infection was quite mild. But soon after, she started experiencing complications and was diagnosed with a balance disorder called vestibular disorder, which makes her feel dizzy and causes constant ringing in her ears.
It's like being on a boat all the time. So when I stand, the floor is like this. So for me to walk straight is a struggle. There was a point where I literally needed to be lifted to go anywhere because I just couldn't get my balance. It can be very overwhelming and exhausting.
While for Roshni, it has been rehabilitative therapy and yoga that have helped her gain a sense of control over her condition. For Sadhna, it's been medication, ample rest, and her pup Pepper, which helped her with her post-COVID complication.
He sleeps with me, he eats with me, like a small child. I have a grandchild home now.
Sadhna says she is a lot better now as she has found some happy distraction with Pepper. But for many like her, the lingering effect of COVID remains inexplicable.